Bustmob, Jenny Eden here. Today I'm going to be interviewing Dr. Fredman, who's our Amelia St. Louis surgeon, which I'm super excited about. You guys have submitted a bunch of questions in, and I want you to know we've got a lot, which I'm really excited about. Mostly breast questions, some liposuction, but we will do our best to answer them. So I'm bringing Dr. Fredman in right now. Hey guys. Ooh, we got a lot of people popping on. Hello.
Hey, how's it going?
Good. How are you doing?
Good. Adjust here. It's good to see you.
You too. Yeah, I always have to adjust the stand. It's like it zooms in every time.
Yeah, it does.
Well, I don't know if you heard, but I have a lot of breast questions.
Great.
A couple liposuction, but mostly we're just focusing on OGs and lifts.
Great.
So I'm just going to launch into it because I do have a lot. And if we don't have time for them, that's okay. I'll tack it on to your next live.
Yeah, that'd be great.
All right, so here we go. Number one, when getting over the muscle implants, which I've noticed a lot of women are getting more of inside a Bustmob, when is it the soonest to resume some light cardio exercise?
Yeah, truthfully, whether over or under, I tell people about the 3-week mark. And the reason for it is if you get your blood pressure, heart rate up too high in those first few weeks, I worry about increasing the chance of bleeding or swelling. So I usually tell people 3 weeks, you're safe to do some light cardio, low impact cardio. I think 3 weeks is fine.
Good to know. I mean, I'm not doing cardio anytime soon, but a lot of people out there do. Oh, I like this one a lot. So this girl had a couple of consultations and she's been told she needs a lift and not need a lift by some other surgeons. So how does she know what to do?
Yeah, that question comes up a lot. And especially you see on Bustmob, somebody will share their pictures and say, I'm confused. Some people said lift, no lift, or just sharing their pictures, say, what do I do? And you have some people say lift or no lift. And I think in those situations, you have to take a step back and focus on your goals, because that's what it comes down to. It comes down to what are your goals? Because for one person's anatomy, one person may need a lift if your goals are consistent with that of a lift, and one person may not if your goals are consistent with not. So start with your goals, really look at them and think about, are your goals showing what you get with the lift? So more of a perky look, more upper fullness, or even like in your goal pictures, are a lot of those people just breast augmentations? Like I think that's a good way because that generally is a perkier look. Or are your goals for really a far more natural look? And then I think that can answer your question. And the reason that some plastic surgeons may be saying yes or no is maybe they haven't spent the time focusing on your goals and they just kind of gave their recommendation, but it really doesn't matter what the recommendation is. It's what procedure is going to get you to your goals in the best way.
Would you say the Vectra 3D imaging helps kind of take some of that guesswork out of it?
Yeah, thanks for bringing that up. So the Vectra is really helpful because the Vectra can allow you to see what a lift looks like, what it doesn't. And I rely on the Vectra a lot. I'll often show people, I'll actually take the Vectra and do a lift on one side and no lift on the other side and implants on both sides. And that's one of the most clear way to see the difference. Like this left breast is what you'll look like with no lift and the right breast is with, and which one do you want? And I think that makes it pretty clear. It definitely helps a lot of people that are unsure decide that they do want a lift actually, because once you see it, and if you're somebody that really doesn't want the look of a lift, it helps with that too.
That is so cool. Technology has come so far.
Yeah.
I did really not have that back in the day, 12 years ago.
Yeah, it's definitely helpful.
What is the biggest difference? Oh, you answered this recently in a reel. So what is the biggest difference between a Sientra 106 and a 107 implant?
Yeah, great question. So 106 and 107 implants are both gummy bear implants that Sientra makes. And the main difference is the 107 implant, is that a 106, 107?
106.
The main difference is a 107 implant is a little bit more cohesive than the 106. The 107 is a little bit more cohesive than the 106, which translates to a little bit more roundness, a little bit more upper shape than a 106. So again, start with the goals. If your goals are to have as much of a kind of sharp line of roundness, as much shape as possible, 107 is a great choice. If you want to have a bit of a softer look, but the ability to play it up a little bit when you want to, 106 is a good choice. They're both great implants though.
Got it. Why is it so important to keep on the paper tape on your incisions post-op for up to 6 weeks?
Yeah, so different surgeons have different recommendations for scars. Here in my practice, and I believe all the Amelia surgeons put paper tape over the incisions and leave it on there for 6 weeks. We've just found that that provides the best conditions for the scar looking as good as it can. Now, there's not one perfect answer. There may be some people that have good experience with ointment or something like that, but we've just generally found that that helps the scars look really good when you take the tape off, and in the end, once they've gone through their whole process, that tape is helpful. So that's why we do that. Occasionally, there's somebody that gets irritated by tape or can't use tape or something like that, and we'll do ointment, and that's okay too.
So I get this question a lot with the paper tape. If it starts to peel off, what should they do? Completely take it off or just reapply?
Yeah, it often does start to peel off, and it kind of depends on how long after. So safe bet always is just take a picture and send it to us, and our team will let you know which one. Because there's some situations where I wouldn't want the tape to be all pulled off, and sometimes just kind of reinforced. But pretty often, and people will often do this on their own, which is good because they're doing the right thing. If it really starts to peel off, just kind of take it back, peel it off a little bit until where it seems like it's really on there good, cut it and put new tape on there.
Because I had to do that with my past 2 exchanges and trim the edges and just reapply the ends, because if I took it off, it would probably take a scab off, but you do find that resistance.
Yeah, at a certain point, if it's really stuck, leave it, cut it, and just put new tape on.
Got it. If I want to remove my implants completely when I'm older, what does that procedure look like, and will I need a lift?
Yeah, that's a really good question. So removing implants is really easy and straightforward. Now, assuming there isn't anything else going on, like there's no capsular contracture, because that obviously would require more surgery, which is more involved. But if everything is good and you just want your implants out, that's a super easy surgery. It can even be done awake with just numbing medicine. All you have to do is just numb up, just like an awake implant exchange. You just numb up that incision, pull the implant out. It takes like 10 minutes max. It's a really easy procedure. There's no real recovery or anything like that. The pocket where the implant is, that capsule just closes off and scars down. You don't need drains or anything like that. So just implant removal is easy. As far as if you need a lift, that depends on your anatomy at the time and your goals. Some people say it's okay if they're, drooping a little bit. I don't care. I just want the implants out. Then you shouldn't get a lift. But if you want to try to change the shape and you have certain goals, then maybe a lift is going to be something that we do. Sometimes people decide to have their implants out, see how things change over time, and then decide if they want to get a lift later. That's an option also.
Would you recommend or not recommend fat grafting to the breast with an implant removal?
Yeah, so fat grafting to the breast can sometimes help add some volume, things like that. But in general, it's just not so practical because you can't get as much volume as you're going to want to likely even get close to what you had with the implant. You would really need multiple surgeries to get back there. And in general, if the goal is to have this sort of shape and volume that you have with an implant, really an implant's going to be the way that I know how to get there. Fat transfer usually is going to be underwhelming.
Got it. Because I know someone would ask that question too. If I didn't ask it, it was going to come in.
Yeah, it's a good question. Yeah.
How soon after a breast augmentation can I get Botox and filler? And can I do it the morning of surgery? I get that question sometimes too. Like, can I come in and get some Botox and filler and then go under?
So I wouldn't do it the morning of surgery. Usually injectors don't want people laying flat for a period of time. And also specifically with lip filler, with the breathing device that you'll have, that could put some pressure on things. So I wouldn't do it before. As far as afterwards, I have no problem if somebody gets Botox and filler when they come back for their 1 week visit. Actually, sometimes people do that. They'll come back for their 1 week visit and time it so that they go to the med spa afterwards. But even the day afterwards, I think is fine. I have no problem with that.
Got it. How long after my breast augmentation should I wait to get my nipples pierced?
Yeah, that's a common question also. There's no specific time that it's really going to be safe versus not safe. The thing that I think about is what wouldn't be good is if you got a nipple piercing and then it got infected. Now, I think that's an uncommon thing to happen, but if you did get an infection with a nipple piercing and you were really soon after surgery, it'd make me a little bit nervous. So when is that safe period of time? 3 months stands out to me as this period of time where you're kind of, from an infection standpoint, in the clear. Could you do it before and it'd be okay? Probably. But I usually tell people, if you're okay waiting, wait 3 months, and then I think you're gonna be okay.
Got it. If I have mild ptosis, maybe you can tell us what that is too, and want more defined upper pole, should I forego the breast lift and just get bigger implants?
Yeah, so silent P usually, ptosis.
Ptosis.
Or quick P, ptosis. Ptosis. But same word, people use that word when talking about a droopy eyelid, ptosis, or breast position. You can say ptosis. So can you, instead of getting a lift, get a bigger implant? And people often ask that, I'm not going to get a lift, I'm just going to go with a bigger implant. Now, there is some truth, and it is a good point, that if you get a bigger implant, it's going to do a better job of giving you more fullness, just because the bigger the implant, the wider the implant, the higher the implant gets up on your chest. And maybe with that, you can have the result that you want. But I always, again, go back to goals, which is, it's not the right thing for somebody to get a 600cc implant to avoid a lift if they actually want the look of a 300cc implant. Like, then you're not going to be happy with the size that you are. So you have to combine everything. You have to say, what size do you want to be? And if you want to be the size that a 600cc implant would give you, and you're borderline, maybe you don't need a lift, and maybe that size will be enough that you don't. So you have to take everything together, see what the goals are, and see if, based on the size that you want and your anatomy, can you get by without a lift, or is a lift going to be needed? Because truly nothing is a replacement for a lift. Nothing is going to tighten up the lower part of the breast and lift things up and change nipple position the way that a lift is. But again, for some people, they may be able to get by without it.
So can you explain to everyone what a waterfall effect is?
Yeah, so good, thanks for asking that. So when implants are placed under the muscle helps to hold the implants up, which is a great thing. And it's one of the helpful things that going under the muscle does. If someone's breast position is low, the muscle is where it is on your chest, and it's going to hold the implant up. But if your breast position is low, if you have more ptosis, with a higher up implant, that breast may be falling or water falling off of the implant. So that's what a waterfall effect is. Literally, like when you look from the side, you would see the implant and you would see the breast like falling off of it. And that's something you have to think about if you're going under the muscle and not doing a lift. Is that going to potentially happen? Now, there's some ways to avoid that. There's something called dual plane, where you can still be under the muscle, but you release a little bit of the layer on top of the muscle, which allows the implants to settle lower. So the implants are going to settle lower, which is a good thing if you want to avoid waterfall deformity. So that's something to talk about if you're doing no lift, under the muscle. A dual plane may be an option.
So how would you correct the waterfall issue? Like, let's say you're post-op and you're like, this doesn't look like how I was picturing.
Yeah.
Can you then go back and get the lift?
Yeah, so the first thing I would say is, have you waited enough time? Because maybe the implants need to drop more and they just haven't settled, and enough time can be a long time. It could be like a year, really, because those muscles in some people can really hold up the implant. So first thing I would say is give it more time. But let's say you give it time and they're not moving, and there is that, you kind of have two options. You could either get the implant to drop lower, or you can lift everything up to where the implant is.
Okay.
And that depends on goals. So it may be that converting to a dual plane, or even converting to over the muscle, is what's needed to get the implants to drop to where they need to be. Or maybe you're happy with where the implants are, you want the breast lifted up, and then you just do a lift on top of it to help with that.
Got it. So if anyone out there has that, there's options.
Yeah. The only other thing that comes up with waterfall is sometimes, especially if it's on one side, like if somebody has waterfall on one side that's been getting worse, that could be a sign of capsular contracture, because capsular contracture also causes an implant to get higher and firmer and rounder over time. So that would be a different situation, and different surgery would be needed.
Got it. All right. Make sure I don't ask the same one. Ooh, okay. So here's one that's not a breast question. Okay. Is there anything non-surgical or surgical that can be done about loose skin under my chin from weight loss?
Yeah, and that comes up a lot when talking about chin liposuction, because we do a lot of chin liposuction, and I don't do facelifts or neck lifts. So that's important, because if somebody has loose skin under the chin, how do they know if they need a facelift or neck lift, or are they a good candidate for chin liposuction? And it often comes down to how much loose skin is there. Now, if you truly have loose skin there from weight loss, chin liposuction is probably not the right thing to do because there's just going to be more loose skin. And liposuction doesn't cut out skin or pull back skin or anything like that. So usually that person is going to want to consider a facelift or neck lift and should, see somebody that specializes in facial plastic surgery.
If someone opts for, maybe they want to get chin liposuction, is there any risk of them having loose skin afterwards?
It can be based on how things are. So if somebody is sort of borderline, I'll have that conversation with them of, we'll get some improvement, but how much skin retraction and contraction happens afterwards is more up to genetics and just your skin quality. Some people have a pretty amazing response afterwards that their skin does get tighter. Some people it doesn't, and they may have a little bit of loose skin afterwards. It doesn't mean that it'll look bad or that they won't have a result that they're happy with, but they'd have to know that going into it. Now, there are non-surgical devices out there that help with skin tightening, and those are things that I would also, if you're thinking in that range of loose skin and maybe neck lift, it's absolutely reasonable to talk to somebody that specializes in non-surgical tightening of skin to see is there a way to avoid a big surgery and still get the improvement that they want.
Cool. Would that be something like Morpheus 8?
Yeah, so there's all these devices out there. Here in St. Louis, we don't have Morpheus, but I believe in Raleigh they may. But there's a lot of devices out there, and I think talking to your provider about what they have the best experience with is important.
Got it. All right, here's that word again. I'm going to skip that one. How long would you have a travel patient stay in town for a mommy makeover?
Okay. So my preface to this also is everybody has their unique situation with travel and things like that, and that's why our patient care coordinators, that's why it's so great to have our wonderful patient care coordinators to talk through that with you, because everyone has their specifics and there's flexibility either way. But in general, the things that we think about when it comes to travel is, one, depending on the surgery you had, it may be helpful for you to be here for a few days afterwards, so that if something were to come up, although very rare, if something were to come up where I want to see you in the days after surgery, I can see you without you having to get on a plane or drive really far. The other thing is we're also very careful about the risk of a blood clot in the legs called the DVT. We know that the risk of a blood clot in the legs increases with long periods of travel or flight. So we have to be careful around the time of surgery to minimize that risk. So that's why for a mommy makeover, usually we tell people 1 to 2 weeks after surgery is how much you should stay in town before traveling back. But some of it depends on, are you driving? Are you flying? If people are flying, we usually say 1 to 2 weeks. If they're driving, if it's less than 4 hours here in St. Louis, which a lot of people drive in that range, then they can drive back right afterwards if they want. If it's after longer than 4 hours, we have them stay overnight.
Okay, good to know. Can you go from a high profile to a moderate plus implant with the same CCs without getting a breast lift? A lot of lift questions.
Yeah, these are really good questions. So you can, but if that's the right thing to do, you can go from high profile to moderate plus, say the same CCs. Now, that may change the look, and if there's something specific about the look that you have and the look that you want, it may be a reasonable thing to do. That's a pretty small change, though. I mean, you're going the same CCs, high profile to moderate plus, you're making changes in the amount of millimeters, really small changes. So you got to make sure that that's really the right thing to do. If something has changed in a way that you feel like you might need a lift, that might not be enough to really give you the result that you want. But again, very specific to how things look and what your goals are as far as what that'll do.
Got it. What is a common misconception about getting a breast augmentation? This one
That's
kind
a great
of put me off. I want to know.
That's a great open question. So a common misconception, I think mostly has to do with recovery and how long recovery is going to take and sort of how bad it's going to be. And maybe that comes from the fact that breast augmentation recovery has changed dramatically over the decades. So if somebody's mom has implants, they probably will tell you a very scary story about what it was like for them and what recovery was like and how much nausea they had after surgery and how stiff they were for such a long time. And that's because things were done very differently then. I remember talking to somebody once that was one of the first people to get implants, in the country, and she was in the hospital for 7 days, hospitalized for 7 days, and with nausea and all those things. And obviously, it's totally different now. So I think that a common misconception is just that recovery is a lot easier than it used to be. Now, everyone's recovery is a little bit different. Some people will say the first few days were just really tough and then it got better. Some people will say it was nothing. It really was like nothing. And it's just different for different people. But overall, especially with the rapid recovery that we do and the techniques that we use, recovery is a lot easier than it used to be. And for most people is really quick to allow them to get back to what they're doing.
That's a really good point, because I had a breast reduction 20 years ago. I didn't realize it was 20 until I was sitting here thinking about it. But it was 20 years ago. And breast reductions now are so different. Like, my recovery was really hard 20 years ago. And I see people like totally fine at 2 days. And I'm like, I don't understand. But yeah, there's so much advancements to medical and technology and everything, that recovery is a lot better than it used to be.
Yeah, for sure. And it's a lot of things combined. It's the whole process. It's anesthesia. It's the team that's involved. It's the actual techniques that are used. And I think that's why it's important to seek out plastic surgeons that specialize in breast surgery or body surgery, have their private surgery centers with a team that are doing these surgeries all the time. I think those things make a difference.
Yes, I agree. Is lipo to the thighs and outer hips too much when having a mommy makeover?
Not at all. People do that very often with mommy makeovers. It's a very commonly added on area. Inner thighs, at least in my practice, probably being the most common. Outer thighs, not uncommon, but inner is a little bit more common. And the reason it's a great thing to add on is it doesn't really change much in terms of recovery. You're still going to have the same garment. We give you a garment that just goes below your knees instead of above your knees, so really minor thing there. But in terms of recovery, it doesn't change much. You're still going to be wearing a garment. So it's a help. It's nice when you can add on a surgery and not really make your recovery more difficult.
I agree. That's when I added the chin liposuction. I'm like, I'm already going to be getting implant exchange. What else did I do? Oh, and bra line lipo. And I was like, why not? And I didn't feel anything here. It was like the easiest thing I've ever done.
Yeah, chin liposuction in general is super easy, and it's a really nice thing to add on to a procedure because it doesn't keep you under anesthesia for very long. It's a quick procedure, and it really is an easy recovery.
Super easy for me, at least. Anyways, there's people out there I'm sure have really bad, but mine was super easy.
People have good recovery with really minimal bruising. I'm always amazed. We follow up at 1 week, at people's 1 week. I rarely can ever see any bruising, which is amazing.
I had it was like this tiny. I could barely even see it. And it was just little, faintly yellow. And it had a little Band-Aid right there. And I was like, that's it?
Yeah.
It's amazing.
Yeah, it's great.
Last question. We have been powering through. What gives a better result, under the muscle or over the muscle placement of the breast implant?
So also good question, and it also depends. It depends on your goals. Again, that's where I would start. It depends on somebody's anatomy. There's absolutely not one specific answer whether which one gives a better result. But again, I'd start with your goals. Look at what's important to you, what type of look is important to you. Then and go to your anatomy. Under the muscle is going to generally be better in people that are more thin. It's going to help put kind of coverage over the implant. If you're over the muscle and really thin, it's hard to cover some of the aspects of the implant, more noticeable rippling, things like that. And then there's other pros and cons that we talk about as far as under the muscle and capsular contracture being less common. And they're different for different people in terms of what is best for them. But that's one of the things that we talk about at a consultation is under the muscle versus over and what's really best for you. Got it.
Well, that is it. We answered 14 questions and I only allotted time for 10. So we did really good.
That's great. Those are great questions.
But I want everyone to know that Dr. Fredman, if you guys are still hanging it with us, he's our Amelia St. Louis surgeon, and you can find him in our Ask a Surgeon subgroup in Bustmob answering questions, and you're doing lives now in the main group answering questions for the ladies, and I really appreciate you giving your time to the Bustmob community like that.
No, it's my pleasure. You guys are great. It means a lot to me to have you guys, and you're a wonderful, wonderful group of people, and thank you all for being who you are.
Well, thank you, Dr. Fredman, for doing Instagram lives too, and we will see you again next month.
Awesome. We'll see you then.
Bye, Dr.
Thanks a lot,
Fredman.
Jenny.